Our current treatment model is costly, a revolving door requiring 5 serious treatment attempts to resolve. The current model is designed to treat the sick and not to keep patients well and prevent relapse or reentry into care. Thanks for being here. I'd like to start off by asking you just to take a moment and think about someone you know or love that has been affected by alcoholism or addiction. It not only affects the person affected, it ravages everyone around them and tears apart families. I'm JD Meints. I'm the founder of NuLife Virtual, and our mission is to solve why addiction treatment fails. Unfortunately, this is a massive market and it affects a lot of people. The drug epidemic exploded during COVID, exposing a massively flawed treatment industry. It also helped, though, prove remote telehealth was less expensive and can be as effective. Currently, $42 billion is spent on addiction treatment in America, servicing only 10% of the population that needs help. NuLife and remote care opens up the additional 90% of this market, enabling us to help more people with less practitioners. And as a nation, we need this because we're short about 230,000 treatment professionals to meet this demand over the next 2 years. And NuLife is a recovery multiplier positioned to help solve this problem. And this problem is personal. I almost died because the current treatment model didn't work for me, but it's not just me it doesn't work for. 4 out of 5 people fail to stay in recovery after treatment, leading to one person dying every 5 minutes from a drug overdose. And we don't want that person to be your loved one. According to the National Library of Medicine and my real life personal experience running treatment centers, our current treatment model is costly, a revolving door requiring 5 serious treatment attempts to resolve. The current model is designed to treat the sick and not to keep patients well and prevent relapse or reentry into care. With NuLife, we help existing brick and mortar providers utilize our technology to reduce time and cost spent in higher levels of care, extending lower cost, more effective levels of life-integrated care and support. This aligns incentives with each stakeholder, benefiting the patient with improved quality of life, the provider with a higher patient lifetime value by keeping them engaged, and payers with lower costs. And because we bridge the gaps between traditional levels of care and integrate life, patients stay engaged and surrounded by professionals and peers, increasing chances of success with fewer attempts. This also keeps patients connected to a single provider, which delivers them a higher percentage of the patient's overall lifetime value. To achieve this, we set ourselves apart from our competitors with a unique blend of clinical care and medical supporting long-term engagement through our social solution peer support network. And this does 2 main things. It extends clinical care options and it strengthens peer social bonds, which are key to long-term recovery success. We've actually found that persistent and consistent engagement resulted in a 58% reduction in readmission and 29% improvement in quality of life, validated in a case study conducted by Aetna with our founders. We're a SaaS platform with monthly subscription rates of $500 per treatment location, $100 per treatment professional, and $25 per patient per month, all paid for by the treatment program. We do expect treatment programs to be reimbursed by insurance payers for the use of our platform. We spent 2 years building our platform with a select few treatment providers and representing the complete spectrum of treatment types and population, all with less than 120,000 outside capital. And now it's time to take this to the broader market. Till date, we have just under 1 million in revenue and expect to reach 1.4 in ARR this year before scaling. We have a proven unstoppable team. I've owned and operated multiple treatment centers. David, my co-founder, was the founder of the first HIPAA secured social network, raising over 18 million in capital by United Healthcare, working with Steve Myers, a former United Health CTO. And John has raised over 150 million for several companies in the past 12 months. Rounding out our team is Cassandra with over 10 years experience. Our $1 million Series Seed round was oversubscribed, led by Limitless Ventures. We expanded that to 3 million. It is 90% committed, and we are closing in March. We do have 200,000 available, and we're asking only for investors who want to help us save lives to invest, so that we don't leave those who've taken the first step alone, to fall, to fail, to die. Thank you.
JD, thank you, and congrats on the success, on the progress on the raise. You talked about engaging with folks and the importance of persistent engagement, the power of persistent engagement. But we all know that user engagement is a huge challenge. How do you actually get people to respond? You can ping them all you want. So talk to me about the strategies for encouraging meaningful engagement.
Yeah, totally. It's one of our big differentiators. One of the things that we found about recovery is that, so what we do is we make being engaged feel cool, to be in recovery, to stay on path. We have multiple groups that are hosted by sober social, influencers that are there to connect. People can connect into communities of interested, things that they're interested in above and beyond their affliction. So we know they start and they're there maybe for clinical and medical support, but what keeps them engaged is what they're interested in life. And so both peer and clinical people can be there for them, at all times.
JD, let me tease that out a little bit, because it's really a unique element here. You said social influencers, affinity groups. I'm putting words in your mouth, but tell me more about what that looks like.
Yeah, so the treatment providers that we allow to digitize and scale their services, they have a walled off area that's secure and can provide all the clinical. But then there's an outside area that people can engage and enable in. And this is both their alumni and community, but a global network of people that are going through recovery, oftentimes at the same stage as them. So they're supported by other people, they're earning rewards. If I'm interested in hiking and I'm traveling, or I want to just go hike with somebody who also is sober, I get to do that. If, we have day one communities where people are sharing all the time, hey, it's day one, and other people are congratulating them and inspiring them. And then they're starting their own affinity communities and then leading. I just saw a weekend group pop up where people, want to stay in recovery on the weekend. So what it's doing is it's helping support the clinical and medical care with peer and social networks that are always available to them, day or night.
Awesome. What is the raise going to enable you to do? So
we have an incredible people in queue to finish out our team of people. Number one, we've got strategic team members that help us make key strategic partnerships with payers and national providers. We want to go after FDA clearance as a software as a service, or software as a medical device, I should say. And then it's going to allow us to really just get to more providers through building out our marketing and our sales force.
You have the distinction of having run multiple recovery centers, and now you're selling into those centers. So you've got a leg up, but I wonder what some of the challenges have been. Any surprises in that process?
Yeah, there always is. I think the biggest one is, how should I say this? Technically challenged clinicians, and getting them on board. Which obviously the pandemic helped. I hate to say it helped people realize, hey, I've got to be on board with virtual care and running sessions, but it doesn't mean they're good at running virtual groups, right? There's one thing to get on Zoom and run a group, but how do I keep people engaged in a 10-person session, in a 15-patient group? So that's really been one of our biggest challenges, is just getting them on board with that whole process. But we're learning and improving with it.
I can see you learning and improving in this microcosm, but where my mind goes is the magnitude of this problem. And I wonder if you could just comment on your 5-year vision. Like, what happens when this scales? How do we use this to tackle just such a massive, explosive problem?
Yeah, it's about having access to care. Like, we are working with one of our clients is a Medicare provider, national Medicare provider, and so they give out these tablets. You can't really see them on Zoom, but they give out these government tablets that they get for for people that do not have access to mobile devices or phone numbers or anything like that, and they load NuLife on it. And so when they check out of their skilled nursing facilities or their acute care hospitals, they are immediately connected with their care team and their provider and their program. So they're never like kind of left alone. And that's the biggest problem with treatment right now, is that how do I get care when I need it the most? And so, being able to connect with somebody at a point of despair is the biggest time. We have that one time when people say, hey, I need help. We've got to grab them at that point, because otherwise they disappear. And oftentimes they don't come back.
Yeah. You went through this journey yourself. This is incredibly personal for you. And now you've helped so many individuals. If you could speak to that individual who has a loved one who's in the situation you are in, what's a piece of advice you'd give them right now?
Get them connected. I mean, however you need to get it connected, it's about reducing friction, right? It doesn't mean, hey, I've got to go to care, or I've got to go to AA, I've got to go to NA. Maybe it just starts with connecting with one person whom they could relate to. And that's the biggest problem with the brick and mortar world. Is the biggest fear that I have is, if I'm a teenager, I'm an adolescent, and I've got a problem, the last thing I want to do is walk into the basement of a church, into one of these support groups, and see 40-year-old dudes, 50-year-old dudes, people I can't relate to. Get them connected with someone that they can relate to at least start that conversation. And so it's just about lowering the stigma and reducing friction, because they have to want to and believe that there is a solution for them. And we have to make it easy. And just till date, it's just been too complicated and too hard to find the right care for each individual.